Broadcast is now starting. All attendees are in listen-only mode.
Hello, everybody. Welcome and thanks for joining us today for our webinar on the CBD use in pediatric treatment of resistant epilepsy. I am Pip Marks, and I am the Project Director for Family Voices of California and will be hosting today's webinar. So before I introduce our wonderful presenters, I'd like to let you know just a little bit about Family Voices of California. We are a statewide coalition of locally based parent-run centers working to ensure that children and youth with special healthcare needs receive quality healthcare. And as the state affiliate of National Family Voices, we are California's federally funded family-to-family health information center, and we provide a statewide support and resources to families of children with special needs. Our webinars serve as statewide and, as in today's case, nationwide trainings on various child health topics and are geared towards very diverse groups, families, professionals, parent-to-parent resource staff, and advocates. So if you have any technical difficulties throughout the presentation today, you can call the GoToWebinar directly at the number on the screen that you see. And due to feedback issues, we also have everybody on mute from our end. However, throughout the webinar, please feel free to type in questions that you've got a little box on the right-hand side of your menu. Please type your questions in there and we will be stopping periodically to address your questions, we will also save some time at the end for additional questions. Today's presentation is being recorded and will be posted on our Family Voices of California website, probably by the end of day tomorrow, with accompanying PowerPoint slides. And after this webinar today, you'll be emailed a very short evaluation survey, and we would really appreciate it if you would take the time. It just take a minute or two to give us your invaluable feedback. We really need it so we can improve our presentations for in the future. So it is now my pleasure to introduce today's speakers, Dr. Brenda Porter and Liliane Ansari. Dr. Porter is the director of the Pediatric Epilepsy program at Stanford. She sees pediatric patients with difficult-to-control epilepsy. Dr. Porter's research focus is on preventing epilepsy in high-risk patients, improving access to and success of epilepsy surgery, and developing clinical trials in genetic epilepsies. And Liliane Ansari, our parent advocate, will be sharing her parent perspective raising a child who's been treated with CBD. After earning her MS in psychology and counseling, Liliane spent approximately 17 years working with various nonprofits and school districts. When her second child was diagnosed with tuberous sclerosis complex, Liliane took time off to care for her increasing needs. And during that time, her daughter had brain resection surgery to stop seizures. Liliane has spent the last 10 years advocating for the needs of both her children who have special needs. So it is my pleasure now to hand over the presenter role to Dr. Porter. Take it away, Dr. Porter.
Okay. Hopefully everyone can now see my screen.
Yes, it's great.
Oh, good. Okay. So welcome everyone, and thank you for joining us. I am going to try today to go over a rather large topic on medical marijuana and the treatment of epilepsy. And I'm going to spend most of my time talking about one of the components of marijuana called CBD or cannabidiol. So I'll try to, by the end of this presentation, hopefully you'll have a much better understanding of the different terminology, like what's marijuana versus CBD. So hopefully you'll come away with a little bit of understanding on that. I do have some disclosures from different companies that I've done work for. I think the most important one is the company that is probably about to launch CBD as a pharmacologic treatment for seizures is this company called Greenwich Biosciences, and I am on their data safety monitoring board for a clinical trial. Okay, so to start with, medical marijuana or marijuana is really complex. It's not one component. There are they estimate about 500 compounds in marijuana that have some effect on the human body. The ones that I'm going to spend most of my time are on the compounds on the far left, the cannabinoids. And there's not just one cannabinoid, there are many. And then we'll spend a little bit of time on the non-cannabinoids. And those are the ones that give you the psychoactive. So when I say psychoactive, those are the ones that give you that euphoria or the high. And really, to date anyway, there's not been much study on them for epilepsy. So we'll really spend most of our time talking about the cannabinoids. And then there are a lot of other compounds that we don't know as much about or what they actually do to people. The two most commonly discussed chemicals are THC. And THC is what people think of with marijuana and like, oh, it's a drug, it gets you high. It has some good side effects though too, besides for the psychoactive component. It does have some anti-nausea effects. It's an appetite stimulant, and it's been studied a little bit for pain relief. I wanted to point out that anti-seizure is not one of its known functions. So I put the check mark there, but you're supposed to note it as not an anti-seizure medication. It has been studied, and it does not appear to have anti-seizure properties in most animal models. CBD, on the other hand, or cannabidiol, has sort of different properties. It has been involved in some studies suggesting it has some pain relief. It has some anti-inflammatory, and when I say anti-inflammatory, that's it suppresses some components of the immune system. It has been shown in animals and now in humans to have anti-seizure properties. It can also slow down your GI system a little bit. And there are some studies, so not in humans really, suggesting it might be neuroprotective. So if there's some kind of injury to the brain, it might have some properties of protection, but that's still not been really looked at in people. So just one more time, THC, not anti-seizure as far as we know, and CBD, anti-seizure. One of the things that is interesting to us as researchers and as physicians is, well, how does CBD work? And I think it kind of goes back to a little bit the question of, well, what about marijuana makes it a plant that we've used over the years to affect the human system? And that's because there are receptors in the brain that actually bind quite well to THC. There are two that we think of, CB1 and CB2. And the lower numbers here mean more binding. And what you see is that it turns out that cannabidiol or CBD does not bind to CB1 or CB2. These numbers are large enough that it's very unlikely that CBD is binding to those receptors. And it explains probably why we don't get the psychoactive effects, because they're really different mechanisms of action for THC and CBD. But it also leaves us the question of, well, if CBD is causing some change in the brain that is anti-seizure, well, how does it do that? We think it's unlikely that it's through the CB1 receptors, and there's other data that suggest that too. If you knock out one of the receptors, you don't have any change in the effects of CBD. There's a whole bunch of possible ways that CBD works in the brain, and I've listed some of them there. I think it's still an open question about why CBD is an anti-seizure medication. And I'm not going to go into any detail today unless somebody really wants to talk about it, but there are a lot of studies going on right now to try to better understand the mechanism of CBD in the brain and why it is an anti-seizure compound. The history is interesting. There were quite a few studies very small studies, mostly in animals and a few in people using CBD. I'm focusing on CBD now, showing that there was a reduction in seizures when patients were given medical marijuana that had a large component of CBD in it. What happened though was in the late 80s, 90s, the government in the US decided that it was Schedule 1 medication, and that made it very hard for people to study it. So things kind of fell off and there wasn't as many ongoing studies. Eventually it was readdressed because a lot of families, including 2 in California, were desperately searching for seizure medications for their children, and they started to try to purify CBD out of medical marijuana. And then once it was proven that there was some CBD in the medical marijuana product and it was helping, GW Pharma, which is now Greenwich, went ahead and started doing an open label trial. And by that, it means that the patient and the family and the doctor all know that the patient is getting CBD. And there was some success. There was about a 40% reduction in seizures. There were some side effects. The patients were sleepier. They had some diarrhea. There was decrease in appetite. And there were some patients that had worsening of their seizures. But it was enough to move forward with another trial. And I'm going to spend a little bit of time on this trial because it's the trial that has the most data reported on CBD. Many of your children or your family members probably do not have Dravet syndrome, but Dravet syndrome is a relatively rare but severe childhood epilepsy syndrome, mostly due to sodium channel mutations. And in the general field, there had been some reports of patients with Dravet syndrome doing very well on CBD. So I think that was part of the reason that Dravet was chosen as a good group to do the study in. So this study actually is with cannabidiol that is purified to the point where it has almost no THC in it, and it's very carefully measured. So it's not the kind of thing that you might get off the internet. This is pharmaceutical grade. By that, I mean they follow the manufacturing guidelines for pharmaceutical products. It was very carefully vetted as far as the amount of CBD that's in it and lack of any other components. And what you see is that I'm not sure if my pointer shows, but the reduction in seizures percentage-wise in the group that received the cannabidiol is about 40%, and the group that had a pretend medication, so not cannabidiol, was about 15%. And there is a difference there, suggesting that patients did benefit from cannabidiol. And again, this is a relatively challenging patient population that had failed, probably many of the patients had failed many medications prior to this. So a good sign that cannabidiol was helpful. They looked at, I just want to sort of focus down here on this section of reduction percentages. What you can see is that there were, this is a little, the presentation of this is a little odd, but a higher number means more success. So if your odds ratio is 2, that means above 1 is good. And what you see, there was kind of a mixed bag. Some patients had a 25% reduction, some patients had a greater than 50% reduction, some patients greater than 75%. And there were a few patients, and I'm afraid not many, who were seizure-free on the cannabidiol. And then down here, we look at the seizure types. So patients with Dravet syndrome often have multiple different seizure types. The seizure type that the study was more focused on was this atonic seizure, so like a drop seizure where suddenly the child will just fall, often injuring themselves. And the higher number, again, is a good thing. So what you can see is that there was quite a big reduction in atonic seizures. There were some other seizure types where really they didn't see much change, such as staring seizures. But overall, what they found was that most patients had a reduction and a few patients were seizure-free. And this is the kind of data that the FDA looks at with a sense of respect, because the families didn't know and the doctors didn't know whether the patient was receiving the cannabidiol or the placebo. So there was no suggestive component to it. And the good news is that this trial, as well as another trial I'll briefly mention, have allowed the FDA to feel confident in the success of the medication for seizures, as well as the safety. So let's talk a little bit about the safety. Adverse events are things that happen during a clinical trial, and we fill out a form that says the child had diarrhea, but we think it was related to an intercurrent illness. So these are things that happen more frequently in the group that receives the cannabidiol. And this will be a recurring theme, but there are some GI issues, diarrhea, vomiting. They were tired, fatigued. There were a few patients that had fever, and there were abnormal results on liver function tests. And the combination of these things together suggested that there are some side effects that are probably going to occur with CBD. There were a few more withdrawals in the trial in the cannabidiol group, but in general, all of these adverse events were not severe enough that most patients stopped the medication because of them. This just lists the number of patients with different side effects, and what you see is there was some diarrhea, tiredness, the fever question, decreased appetite, and then the fatigue, the somnolence. There were a few patients that seemed like maybe they had more seizures. This is not uncommon in, if you looked at any kind of other seizure study, you might see very similar findings. So there are some side effects. They're generally well tolerated to the point where most people don't want to come off the medication if they're receiving some benefit from the medicine. The medicine is called Epidiolex. That's the name that the company gave the CBD. And recently, some other data has come out on a syndrome that's another sort of severe epilepsy syndrome of childhood with mixed seizure types. And I point this out because the way the study was done, there was 2 doses of CBD given, 10 milligrams per kilogram per day or 20 milligrams per kilogram per day. And they counted the drop or atonic seizures. And what you see is that there was about a 40% reduction using either the 10 milligram per kilogram per day or the 20 milligram per kilogram per day. Again, there were some withdrawals because of these adverse events. And again, it was mostly drowsiness and gastrointestinal illness issues. I want to point out that these studies showed me as a physician what side effects to look for as far as interaction with other seizure medications. So most of the patients in these trials were on other seizure medications. Actually, I'm sure all of them were on other seizure medications because it was an add-on study. So the most important one that has really come to the forefront for me is clobazam. Clobazam is also known as Onfi. And a lot of the patients are on clobazam or Onfi because it's been studied quite a bit for the 2 seizure syndromes that we talked about, Dravet and Lennox-Gastaut. and it's quite effective in those seizure syndromes. What we found was that the levels of clobazam or one of the metabolites of clobazam go up when you're placed on CBD. You can see here that this is a baseline level, and then there was an increase. In some patients, there was an increase such that the dose had to be reduced of the clobazam or the clobazam metabolite. What happened was the patients were extremely somnolent, and without the dose reduction, the patients probably couldn't have tolerated the study drug. Interestingly, and I don't think I understand this, some of the patients seem to not have as large increase in clobazam or on-Phe levels as others. But as you can see, some patients had like a 2 or 3-fold increase in their clobazam or their clobazam metabolites. And that is still an area that I think we don't completely understand how best to introduce CBD to a patient that's on clobazam, but we should all be aware that there are likely to be side effects. Some of the other medications also had minor changes in their blood levels. The mechanism for these changes is likely due to the liver metabolism of CBD. When the liver metabolizes CBD, it slows down the metabolism of some other drugs, and that interaction causes an elevated in the blood level because the liver is not able to metabolize on-Phe or clobazam as well. Not mentioned in this slide is that there were liver function abnormalities that were found, and that seems to be in relationship to another seizure medication, valproic acid or Depakote, of which many patients are also on because it's very effective for Lennox-Gastaut and Dravet. Some kind of interaction is going on that the liver starts to show elevations in some of the enzymes that it produces mildly. No patients have had frank liver failure or any issues like that, but there are some laboratory abnormalities, and I think we still are learning a little bit about who is at risk for that, though Depakote does seem to be a risk so far that's been identified. So I'm using the term medical marijuana here to mean other compounds besides CBD, because I think up to this point, what I've shown you is that CBD in carefully controlled trials is effective as a seizure medication. Is it completely going to make most children seizure-free? It does not appear that way, but it may make some, and it generally is pretty well tolerated. But there have been almost really no good studies on medical marijuana in epilepsy. And the reasons for that is it's really hard to do a well-controlled trial in this, but you're about to hear about someone who has had success. So I don't think it does seem like some patients are helped quite a bit by medical marijuana. Is it the CBD component in it? I don't know. I did a long time ago a study, and other people have done studies trying to address this question, because families will come to us and say, oh, my child's on medical marijuana and they're doing better or they're not doing better. What should we do to try to improve their success rate? And that's been really quite challenging to know how to help people. But they do report some side effects very similar to the CBD. And when you start to really delve down into what the parents are reporting they're giving their children, my sense is that there's very low levels of CBD in comparison to the trials I just spoke about. So Lillian is going to talk a little bit about her family's experience with CBD, but I guess if there's any burning questions, I could answer them now, or we could wait until Lillian chats.
I don't see any burning questions, so let's move on with Lillian. Thank you, Dr. Porter.
Thanks, everyone. So again, this is just our one family's experience, as Dr. Porter mentioned. My daughter, Atrina, was diagnosed with a genetic disorder, tuberous sclerosis complex, shortly after she was born. At 8 months old, she started having infantile spasms and had to go on medication, seizure meds, that controlled the infantile spasms at the time. About 5 or 6 months later, the seizures came back in the form of partial complex seizures. And at that point, she was having about 50 to 60 seizures a day around the clock. She was then evaluated for a resection surgery, a brain resection surgery to remove the part of her brain where most of the seizures were coming from. And the picture you see is from the day of surgery when they were putting the leads on her head. She had the surgery at 22 months old. It was actually exactly 8 years ago, yesterday, where she had the surgery. Surgery was very successful, though very difficult to decide to go through. The process was difficult, but it was very successful until about 5 years later, when her seizures returned. At that point, she was already on seizure meds. We were just too afraid to take her completely off of them because when we had tried in the past, her seizures returned. So she was on one seizure medicine, which is kind of not bad for a kiddo in her position that has multiple brain tumors. A lot of the kids in our situation could be on 3 or 4 seizure meds and still not have seizure control. So 5 years post-surgery, as I mentioned, seizures returned, and we consulted with the TS clinic, and they wanted to put her on an additional medication for seizures. We were reluctant because she was already on 2 other meds to address other issues, anxiety and sleep and such. So we decided to try the CBD with Atrina. Now, mind you, I was not the parent that was very comfortable with trying this. I was the parent who, when hearing the word marijuana, even medical marijuana, I was very scared and reluctant, and was difficult to even think about it. But we decided to give it a shot and put her on the CBD tinctures. We happened to have great success with it. I noticed that the seizures stopped, and whether it was related or not, again, our experience was that we noticed that her speech had improved, her play became more sophisticated. Now, again, this is not very scientific. It was just our experience. I don't know if it was because she was having less seizures. I don't know if it was because of the CBD, but we did have great success with it, and noticed that she was just generally happier and calmer. The challenges for us were that we didn't really have a lot of guidance on what to try, what component, what percentage, what to try. The dosing was difficult. It was always basically based on our own research. We didn't have a lot of guidance on how to dose her, what components to give her. We didn't know what we were getting. We were just getting the tinctures online or from a dispensary here in California, and had no idea what the shelf life was, how pure the product was, how well it was regulated or tested. We were just kind of going into it blindly. The benefits were definitely the seizure control, and as I mentioned, the more sophisticated play and language, is her generally being calmer. We started with a 10-to-1 ratio, 10 parts CBD, 1 part THC, a tincture, and had to experiment with a lot of different ones to find the ones my daughter would take, because a lot of them didn't taste very good and there were goopy, difficult to administer. So we found one that we liked, started with a 10-to-1 ratio and moved her up to now 30-to-1 ratio, 30 CBD, 1 THC. And thankfully, it's still continuing to be effective, and we plan on keeping her on it until we can get a prescription or get our insurance to pay for it. It is expensive, but again, just like with everything else, we've had to weigh the benefits versus, the challenges, and continue to keep her on it. So that's basically our story. And Atrina is now 9 years old, and she's still seizure-free with her meds. And I'd be happy to take any questions if anyone has any. Thank you.
Thank you, Liliane. That's wonderful that Atrina's doing so well now. I do have a couple of questions from attendees. Has somebody asked, has Atrina had any side effects, specifically the ones that Dr. Porter spoke about in the clinical trials?
Right. So we have not noticed any side effects with her. She, of course, wasn't part of a study. This was just us doing it on our own. So I don't know if it affected her liver functions or anything. Her kidney functions were tested, and that was her kidney function was normal. Blood work has been normal. And yeah, no gastrointestinal issues or anything else. She's very energetic and happy and most of the time. And we haven't noticed any sleepiness or fatigue with her. So she has really not had any adverse side effects, thankfully.
Okay. Yeah, great. The other question is, I think this is definitely directed to you, Liliane. When you with the lack of any reliable data on the use of THC, I'm wondering what led you to go with a CBD THC ratio.
So in my unofficial mom research, I found that typically having just a small amount of THC made the CBD more effective for kids like Atrina. That they sort of work as a yin and yang, that the CBD is a neuroprotector and it kind of calms everything down, but a small amount of THC showed that it was more effective. With us, we did initially try the CBD only and didn't really see a benefit. And it was difficult. I mean, we tried about probably 10 different tinctures until we found the one that worked.
Okay.
But we didn't really see any adverse effects with the others. We just didn't see the benefit either.
Okay. And when you
so it was a lot of trial and error for us, basically,
yeah.
which again was challenges.
So another question, when you use CBD for a child, do they need a medical marijuana card, or is the parent getting recreational CBD on behalf of the child?
So here in California, initially, when we first started giving it to my daughter, it was medical marijuana was legal for medical use. But in order for us to be able to give it to a child, I had to get a caregiver card with her name on it, so that it was all legitimate and legal. Now in California, of course, it is legal for recreational use, although not for anyone under 21. So I still have a caregiver card, even though it's marijuana is legal in California for medical or recreational use. I still have to have a caregiver card for her because she's a minor.
So was Katrina's neurologist supportive of your choice to try CBD?
Yes, he was, and she was. We had two different neurologists, including Dr. Porter. They were supportive, although they couldn't prescribe it or really, tell me what direction to go. But they were supportive. But the medical, the caregiver card, I had to get from a different clinic. That's all they did. They specialized in medical marijuana cards.
Okay, there's a lot of questions coming in, which I'm going to save. Let me just see if there's one more for you specifically. Oh, no, I'll leave these ones for the end for you, Dr. Porter. So why don't we keep on moving through your, thanks, Liliane.
Thank you. Actually, we touched on some of this, which is that medical marijuana is often very challenging for everyone, the parents, the doctor, because we don't really know what you are getting in that bottle. And when I say that, the bottles are kind of vaguely labeled in many ways, and I have a lot of trouble knowing how much CBD is in there. Not only because, well, what the label says sometimes is very unclear, but also because the regulation of those bottles is not what we in medicine usually think is sufficient to be assured that every single bottle is exactly what it says on the label. But when you start to try to take what the bottle says of the tincture and then extrapolate that to the data that we now have on CBD in children from the studies, which a 10-kilogram child, which is about 25 pounds, would be in the study would be on 50 to 100 milligrams of CBD twice a day. And that, as Liliane just said, is very expensive. Assuming what is on the label somehow represents really how much CBD in that bottle, I've heard families spend about $500 to $1,000 a month for an average size toddler. When you start to talk about an adult, which is a higher dose, I think it's even more expensive. So it's not that the physicians don't want to try to help you make your child better. It's just we don't have sufficient really information to feel very confident about what you're giving your child often. So I just want to make that clear that the dosing is pretty high when you start to think about it from the standpoint of the trial data, and very expensive, and insurance will not pay for it. There are a lot of ongoing clinical trials with CBD. There's a website that you can go to called clinicaltrials.gov, and it lists different trials that are open. And several have been closed recently, including the two that I talked about on Gervais and Lennox-Gastaut. And some of these other trials, though they haven't really reported all their data yet. There are some trials that are not epilepsy focused. Autism seems to be a topic where I think some of the medical marijuana is moving into more of an autism treatment strategy. But at this point, I would recommend, if you really are interested in seeing if there's any clinical trials your child would be, or your family member would be eligible for, you might go to clinicaltrials.gov. I predict that within the next few months, there will be a clinical formulation of CBD from Greenwich Biosciences that will be available from a pharmacy. I don't know exactly when, so I've been told that it will probably be in the fall. The approval, so when a drug is approved, it's sort of approved for certain types of seizures. And the first approval, I think, will be for Gervais and Lennox-Gastaut. I don't know. I have a lot of families whose child doesn't have one of these syndromes. Will they be eligible to get the medication through their prescription plan and through the pharmacy? I just don't know. Certainly, we as pediatric neurologists prescribe medications off label because there's relatively few medications available that are well tested in children. So we will see. There will be more CBD studies in different disorders, autism, inflammation, pain. And I think the problem that I'm worried about is the hype maybe not meeting the family's desires and my desire, which is to really make more kids seizure-free without many side effects. Lillian's response was really nice. I've had many families that have tried various things and have had no response, including some of my patients who have been in the trial and I know got relatively high doses of CBD. So we will see. It does seem helpful, but maybe not as good as we would like. I'm just going to put this up here briefly. If anyone has any patients with tuberous sclerosis who are under 6 months of age, I would love to meet them because we have a clinical trial going on trying to prevent epilepsy. So that's my little advertisement, but I will go back to the slide. Thank you.
Thank you, Dr. Porter. Now, there's quite a few questions that have come in, so you're okay if we go ahead with the Q&A now?
Yep.
Okay. For a question for both of you, what guidance can you provide parents whose doctors are resistant to working with families who want to try CBD? Dr. Porter?
Well, I mean, I think it really comes down a little bit to when you say resistant, it may be that they really just don't know what to tell you very well because, you know, we think in a very proof-oriented way. And right now the proof on the tinctures is not solid. So we're reluctant to tell you to go buy something off the internet that is not carefully vetted for all the different components in it. This is totally anecdotal, but I do have families that feel like the marijuana product is working well for them, and then they switch bottles, maybe from the same supplier, but a new bottle. And there's a lot of issues. Sometimes they become very somnolent suddenly, or I've had some kids get some weird swelling in their face. I don't know what that is. So all these things make us all very anxious about giving recommendations. I don't prescribe, I don't recommend, but if a family goes out and does something, I want to know about it because I want to be able to help them get through it as safely as we can. So I'm not sure when you say reluctant what you mean exactly, but I think most of us now realize families are going to do these things, and probably the best way to help them is to at least prevent harm.
Yeah.
So there will be another neurologist out there that will do what I think I just said if you need to keep looking for someone.
Right. Thank you. Yeah. Another question for you, Dr. Porter. From one of our attendees says, there are known cases of CPS, Children's Protective Services, being called on parents who are treating their children with medical cannabis. Do you have any advice for parents on how they can protect themselves? She goes on to say, I understand parents should have a letter from the doctor confirming it as a medicinal purpose, and they should have a county card issued to them as well. Is there anything else that you would suggest?
That seems reasonable. I must say I've never heard of anyone having this issue in California. Lillian, have you heard of anyone?
No, I haven't, or from other states. I mean, if they didn't have a caregiver card, yes, but
Okay.
I don't know of any situation where if they had a caregiver card and a letter from their physician that they got in trouble with CPS. I haven't heard of.
Okay.
No, I haven't either.
Can you, Dr. Porter, comment on the age of the patients in the studies or the anecdotal accounts of success or not? It seems young patients with Dravet's are the main group showing remarkable benefits from CBD.
Yeah, as far as the study enrollment criteria, I believe that it was into adulthood. I don't know the numbers off the top of my head, how many patients were actually over 18, but the enrollment was not limited to children in both of the studies, I'm pretty sure. I say that now and I'm not 100% sure. I think there are adults included. So I don't know of any data suggesting there's one age group that is more susceptible to success than others.
Okay. Speaking of conditions, this an attendee is asking, do you know if this has been successful with patients who have Landau-Kleffner syndrome?
Oh, I do not know that. Yeah, I'm trying to think of all my patients. I've had some patients who have Landau-Kleffner who have tried CBD. I can't think of any with remarkable success, though they often are on multiple therapies at the same time, and that makes it hard to know if the CBD was, you know, the key indicator of improvement.
Okay.
Don't know.
The same person is asking, for those who have had liver function issues as a side effect. Sorry, let me just. I'm sorry. As a side effect, were there countermeasures taken to manage those?
Well, in the studies, many of the patients just were taken off the medication. I think, you know, there's some kind of synergistic, it appears anyway, it's starting to look like Depakote and CBD together are the issue. So I guess you could talk to your physician about whether they want to remove the Depakote if that is possible, or lower the dose. I don't actually know what to tell people. In my own practice, when it's happened, I've more carefully followed the liver function test, and it seems as though the levels will fluctuate a little bit, and I haven't actually taken anyone off, but I might, I guess, if something ended up looking like it was getting worse over time.
Okay. One mom is asking, she says, we're thinking about revisiting CBD or Epidiolex, sorry, my pronunciation of the name, for our 19-year-old daughter with Lennox-Gastaut syndrome. What do you think about the idea of asking our neurologist to do an EEG after weaning her or significantly reducing one of the meds she's already on before starting the CBD? She hasn't had an EEG in 3+ years, and we're already in the process of reducing one of her meds.
I think that's really something you need to talk to your neurologist about. I am in my own patient population recommending the following. I'm sorry, it doesn't totally answer her question about the EEG, which I think is really very patient, specific. But if I have a family that has tried, the tinctures and they've had no success, and they have Lennox-Gastaut or Dravet, and this drug becomes available at a pharmaceutical grade, I am going to recommend to them that they go ahead and try it, and not assume that, let's say you had failure with the tincture, that means you will have failure with the pharmaceutical grade version of this. Mostly because, one, I'm not always really sure how much dose you got, and two, I think it's kind of apples to oranges. They're really not the exact same composition, probably. So I've been recommending people, when it does become available, that we don't assume you failed CBD because of your prior experience with medical marijuana.
Okay, thank you. Another question, what do we know about the patient developing resistance to the medication, whereas the beneficial effects reduced over time?
For reasons I think we have a poor understanding of, though we have a few ideas, many seizure medications tend to have a honeymoon period where when you first start them, you do well. And then over time, you build either resistance to the medication, or you no longer have success, or as good a success with seizure control. So I would assume CBD might fall into that category too. We don't have great ways to get around this. The most classic one I think of is Keppra, where you get a very nice honeymoon, and then probably your brain starts to downregulate the molecule that the drug was working on. And that's why you lose efficacy. GABA drugs like phenobarbital or, Ativan, same kind of idea, where your brain is pretty savvy and it starts to turn off some of the things that were being bound by the drug. So CBD may have that same problem. We haven't gotten a good way to fix that, though.
Okay. And then another question, is there any development in regulation with regard to quality control of the substance?
As far as, well, I guess they're talking about outside of the Greenwich Biosciences product. Yeah. No, actually, I don't think there's going to be. There's not an infrastructure for these non-FDA approved drugs to be carefully evaluated.
Right. I think, one attendee is asking for information about the clinical trials that they would like to share it with their epilepsy group. Do you have information you could send me that I can pass on to them? The different clinical trials?
I can send you I can just do the search that you would do in clinicaltrials.gov, and I can send that to you. But, a lot of them, are, in sort of various states. Yeah. So I could send you that is how I would find out, is I would go to clinicaltrials.gov and put in epilepsy or autism and marijuana, or epilepsy and cannabidiol or something like that. And it's a pretty straightforward search function.
Yeah, well, I could do that, so thank you.
Okay.
Okay, we're almost out of time, but a couple more questions. If has CBD been used with the Curagen diet? I'm sorry, has this
ketogenic, maybe? Ketogenic?
Curagen. I'm not sure. Curagenetic. I'm not sure what that.
Is it KETO?
KEROGEN. That might be a typo. I'm not sure. I have not heard of that.
It's probably the ketogenic diet, I would guess.
Probably.
So I have patients that have been on both, and they have not lost ketosis. I'm anxious about that, because you don't really know what's in the tincture, how much sugar there is. That's not something that you're going to be able to find out. But so far, I have not had a patient lose ketosis. So that's been good. Most of the tinctures are in a sort of an oily gamish, and as you know, on the ketogenic diet, oil is good. So maybe that's why I've had success, but I do have the families check ketones more often if they do that transition.
Okay.
Lillian, your kids haven't been on the diet, right?
No, they haven't been on keto diet.
Yeah.
Lillian, there's a question here for you by a parent saying, where can I start with my son's journey of starting with CBD? Where do they start?
I guess it depends on what state you're in. If you would like, you could email me, and I can kind of help you guide the process. But here in California, what we did was just make an appointment with a local clinic. There are various clinics that specialize in issuing caregiver cards for families.
Oh, let you know.
So you start with the clinic, and then once you get your card, you basically walk into a dispensary and ask them what you need. You'd have to do a lot of research on your own.
Okay, Lillian, I will send you this attendees. I'll connect you through an email. That would be great. Yeah, it is a ketogenic diet. I'm sorry for mispronouncing that. Let me see. Is there any information with regard to CBD reducing intractable spikes. I'm not sure. I'm not familiar with epilepsy, so I'm sorry. I do not know the language.
Yeah, that's exactly right. So ictal means a seizure, and interictal means in between seizures.
Okay.
And one of the things that patients with epilepsy have are these spikes, which are not seizures per se, but they're like a marker for seizures. And there's pretty good evidence that having a lot of those can impair some cognitive development. So it would be good if all our seizure meds suppress the spikes. As part of the studies, there were EEGs collected, but as far as I'm aware, they have not reported any outcomes on that. So my guess is that pretty soon after it does become commercially available and people are starting to get EEGs, we'll have a much better feel for that. There are certain seizure meds out there like Depakote, often has pretty good effects on interictal sharps and spikes. So it may be known, but I don't know it, and I bet you in like a year from now we'll have a better idea.
Okay, thank you. Are there any known interactions with CB? That must be Lillian's dog, Walter.
Sorry, I'll go on mute.
Are there any known interactions with CBD with other AEDs, in particular clonazepam, valproic acid, or oxcarbazepine?
Well, ONC is clobazam, but so yes, there's definitely an interaction. I spoke about the fact that it causes elevations in the blood levels of clobazam or ONC to the point where many patients become kind of somnolent or sleepy. The Depakote interaction seems to be more from a liver function test. Some patients have elevated liver function. So that when I say liver function enzymes are elevated, it means when you do a blood test, you see more of these enzymes in the blood suggesting the liver is irritated. As far as I know, triliptol is not one that there is an interaction with that I can think of. But I think one thing I think I've seen, at least this is again anecdotally, in many of my patients that quotes are on CBD, I don't see the liver function abnormalities with the Depakote. And when the patients are in a study or they are on super high doses of the tinctures, quotes super high doses, which I think are actually more like the levels in the studies, I do see some liver function abnormalities. So I think many people are on kind of a lowish dose of CBD. And there I don't see the liver problems as much.
Okay, and another person asked me about interactions with, and again, I apologize for my pronunciation, lamotrigine or gene.
Lamotrigine.
Yes.
Lillian, you probably, if you're there, you could address that because.
Well, yeah, my daughter does take lamotrigine. Thank you for remembering. You're amazing. So she's on a pretty moderate dose of lamotrigine or lamictal, and again, one person's experience, we haven't noticed any adverse reactions.
Okay. Mm-hmm. Thank you, Lillian. Well, it is time to close the webinar, and there are a couple more questions which I will email to Dr. Porter and Lillian and share with the people that are requesting answers. Thank you both so much. And I just want to remind our attendees not to forget to fill out the very short evaluation survey to help us, build better webinars for the future. So thanks, everybody. Have a great day. Bye-bye.
Thank you. Bye.
Bye.